Greetings, everybody. My name is Mike Bond. I am on the board at United Way of Weld County, and I'm also Chief Operating Officer with the Weld Trust. So we certainly appreciate you signing in electronically and remotely, and your participation in this forum this afternoon. It should be interesting. I'd like for each of the presenters, we've got some very qualified folks who are going to share some expertise, and I'd like for each one of them to take just a minute or so to introduce themselves and give a little bit of background. So, Angel, you want to get us going? Angel Flores.
Yeah, my name is Angel Flores, and I pastor Mosaic Church in Evans, which is right next door to Sam's Club, and I serve on the board for United Way of Weld County. My area of emphasis that I oversee is Weld's Way Home, so this is right in my wheelhouse. So thank you all for joining us. Excited to be here.
Melanie.
Good afternoon, everyone. My name is Melanie Woolman. I am the Director of Community Impact at United Way of Weld County. That means I do a lot of different things, but one of the hats that I wear is I get to oversee a lot of the local, regional, and statewide homelessness work that we do here at United Way of Weld County.
Thanks, Melanie. Meredith.
Hi, everyone. My name's Meredith Munoz, and I work with North Colorado Health Alliance. And I head up the Community Action Collaborative program, which is really a tight-knit collaborative within our community that works on prevention and diversion from high-cost systems. So that includes emergent response, emergency room visits, a judicial system, and of course, the homelessness response that we work hard towards every single day.
Thanks, Meredith. And Jodi.
Hello, everyone, and thank you for inviting me to be part of this forum. I'm with the High Plains Housing Development Corporation. Many of you may remember me from the Greeley Transitional House, where I worked to help address homelessness. So now I have the privilege of being on the other end of this spectrum, and I'm working to help our community develop affordable housing. So excited to talk to you a little bit more about that.
Thank you, Jodi. Then Janine. Janine.
Yes.
Not that she needs an introduction.
I'm Janine Trustwell, and I'm President and CEO of United Way of Weld County, and it's a pleasure to be here today.
Thanks, Janine. Hey, a couple of housekeeping points. We've all gotten used to these remote forums. So two things. One, if you're not muted, if you could mute yourself, so in case any background noise pops up, it doesn't distract us. And then Tom will be keeping us on task in terms of responding to any questions you have. So if you have questions throughout the course of the presentation, don't be afraid to submit them to the chat room. And Tom will make sure I get them, and so we have a chance to ask those questions towards the end of the presentation. So the first presenter here is Angel, and the question we have for Angel is, what is exactly the problem that we have in Weld County, and why is United Way taking a very active approach in addressing it? Angel?
So the obvious problem is there are people living out of doors, outside of housing. And there are two sides to this. There are one side is the humanity issue, right? These are people. And it's important for us to recognize that more than half of the folks that are experiencing homelessness in Weld County are from Weld County. They're not faceless drifters that are just passing through or hitchhiking. And there is definitely some of that. But the majority of folks that are experiencing homelessness in Weld County are from here. So these are people that we know. We sat next to them in kindergarten, or we played on the same basketball team in middle school, or we went to high school with them. And then somehow, somewhere along the way, their life took a different turn than ours, and now they find themselves in a place of vulnerability and need. And one of the more callous approaches that I've seen people take is, well, you know, I worked hard and I pulled myself up by my own bootstraps, and why can't they do that, right? That's a very common response. And not everybody has been dealt the same deck of cards in life. Maybe if you were 18 or 19 and you lost your parents, and then you got in a car accident and you broke your legs, and now, I mean, people go down very different paths in life. And so there is certainly the human side of this, where we want to be decent as a community, and not let people, especially in this time of year now. Last night was below zero. And not long ago, I remember reading about a couple who were sleeping in their car, and they were trying to keep themselves warm with one of those catering, I think it's a sterno candle, and they were overcome by the fumes and they lost their lives. And just as human beings, we can't just turn a blind eye to that kind of thing. So there's definitely the humanity side of it. The other side, which I think is a little more practical, is the financial side. There is a cost associated with doing nothing. Now, there is a cost associated with addressing the problem too. But most of the people who experience homelessness or housing instability can be resolved in a day or two. And that's what we do at the Housing Navigation Center, which you'll hear more about. But with some support, that usually can resolve itself. That's the vast majority of people who experience homelessness. But then there are those who are what we would call chronically homeless. And these are folks who have lived out of doors for several years. They are the folks that you think of when you think of a homeless person. So this week I read a report written by Malcolm Gladwell on Reno, Nevada. And it came out a few years ago, and it profiled 3 of their most chronically homeless men, the folks in their community that everybody kind of knew, that had been through the system multiple times. And in this report, it tallied up what the bill that each of these men had run up at their local hospital in the last 6 months. So in 6 months, one of them accumulated a bill at a hospital of $50,000. The second ran up a bill of $65,000. And then there was a guy there in the report, his name was Murray Barr, and his bill for that previous 6 months was $100,000 plus. And they estimated that in his lifetime, Murray had accumulated hospital bills in excess of $1 million. And so they called him $1 Million Murray. And so the work that we're doing comes at a cost, there's no doubt about that. But the cost of ignoring the problem, when you consider ER visits, 911 calls, police, fire, ambulance response, detox visits, all of that kind of stuff, you can see that those bills run much higher. And so we are tackling this problem in a way that I think is both human and compassionate. And it's also the most cost-effective way to deal with this, because if we ignore it, the cost is going to be much higher to us as a community than if we collectively attack it. And I think we can actually bring that down. So those are the 2 sides that I wanted to hit on, both the human and then the financial.
Thanks, Angel. Hey, Melanie, we've United Way has taken a very active role in the whole continuum of care, and so could you be a little bit more specific about that and share what is being done?
Yeah. So Angel, I think, described it perfectly. Every story of homelessness looks different, right? So we have those folks that only experience homelessness for a couple of days, and we have those folks that experience homelessness for a really long time. And so we knew as a community that we needed to respond to and come up with a plan for responding to folks across the spectrum, right? No matter what level of need they have. And so that's exactly what we did. A couple of years ago now, United Way convened a community planning process, a 13-month-long strategic planning process. And we had folks from all over Weld County, different facets of life, different day jobs, all come together and come up with a plan. And that plan we call Weld's Way Home. And now that plan has a couple of different priorities that have actually grown and sort of moved throughout time. And I think we're going to pop those priorities up onto the screen here just in a bit for you to see all of those. We have so many things that I could talk to you about today. You'll see all of the priorities on the left-hand side of the screen there in that blue, yellow, red, and then green all the way down at the bottom. So I'll just touch on all of those really quickly. And then I really want to talk just real quickly about the Navigation Center and Cold Weather Shelter in specifically. But as you see there, this group of community leaders and volunteers said that we need to be focusing on community education, affordable housing with case management, homelessness prevention, discharge planning, so helping people to exit institutions like hospitals and jails and those types of things, diversion, so quickly getting folks back to where they need to be or back to their support systems, street outreach for people that are living out of doors, something we called shared intake and assessment, which is basically coordinating all of the agencies that work with individuals and households experiencing homelessness, emergency shelter, which includes both year-round shelter as well as cold weather shelter for those cold weather months, a navigation center, and then finally expanded case management to be able to support those folks that are experiencing homelessness. And so the group said, if we can focus on and we can have a really good plan in place for all of those things, we can do this. We can end homelessness and not only end homelessness, but work to prevent people from ever losing their homes in the first place. And so what I really wanted to just talk about here today is one facet of that work, which is the Housing Navigation Center and the Cold Weather Shelter. One of the largest gaps that we had in our community a couple of years ago was a place for folks to go to get connected, particularly those folks that have really high needs, right? It can be really difficult for everyone to make it all around town, only utilizing the bus or by walking or on their bike to go to all of these different agencies and try to make their appointments on time and get to all these different places, go up to North Range for an appointment, then go over to the food bank and then stop by the Weld County Department of Human Services. And so we said, if we could have a central location to help folks navigate that system and then connect them to housing, we will be much more successful. And so that is what we have developed. We have a housing navigation center that is actually co-located over in Evans at the Sunrise Montvert Family Clinic. And so that's right past the intersection there of Highway 34 and US 85. And that location has, as I mentioned, Sunrise Community Health, has the North Colorado Health Alliance, the Immigrant and Refugee Center. There's lots of different partners all in that building. And so we felt like this is a really great location to have a navigation center. The city of Evans, the city of Greeley, Sunrise, North Colorado Health Alliance, many, many partners all work together to help make sure that this location, we had it for a couple of years and that it was successful. And so what the Navigation Center is just that, is a location there where many different case managers can come and hold office hours. So we have folks like the VA and the Volunteers of America that both work with veterans experiencing homelessness, and they hold office hours at the Navigation Center a couple times a week. So that way, they can come to the people that are experiencing homelessness and they can have their conversation all in one location. The Navigation Center does everything from connect people to those case managers and all of our partner agencies to provide essential services, right? We actually partner with the Weld County Food Bank to have food there every day for folks. We give out hygiene supplies and socks and gloves and hats and all those types of things, right? So we really provide an entire continuum of services for folks that are needing that assistance. And one of the main things that we do at the Navigation Center is provide cold weather shelter in these cold months. And so that typically runs sometime early November through mid to end of April. And it is just night by night, overtime, shelter for single men and women that are over the age of 18. We do have a really robust shelter system for families experiencing homelessness and lots of safety nets for those folks. So anyone with children under the age of 18, we try to connect immediately to one of our partner shelters in town and to other services as well. And so the cold weather shelter, as you saw on the screen there a minute ago, was also one of those priorities, right? We know that the solution to ending homelessness is housing. And as you'll hear from Jodi, I suspect later on in the presentation, housing doesn't get built overnight. And so we know that we need a place to keep people safe in the meantime. And that is exactly what the cold weather shelter does. Anyone can come on any night. All they have to do is fill out a little bit of paperwork, and then we give them a meal and a safe place to rest for the night. That is the intent of the cold weather shelter. And really, it is such a stabilizing factor. We have folks from all walks of life that end up at the cold weather shelter. We've had people that have their PhDs stay at the cold weather shelter. And we've had folks that, have been in our community, with severe persistent mental illness for years and years that utilize the cold weather shelter to stay safe. And so those are just two very small components of all of the work that we do. They are some of the most critical because they do provide that direct support for the people that truly are the most vulnerable in this community. And so we really wanted to take an opportunity to highlight those. I'm sitting here looking out the window, seeing all of the snow and all the folks walk by with their jackets and everything. And I'm just reminded of how important that work is, right? And I try to remember, not to be too pessimistic when I, when I walk outside in the morning and my car is cold or, something like that, right? So really the work is so, so critical, and we've helped so many people. You can see on the screen there, since just April of 2019, we've served 542 households. That is heartbreaking and incredible all at the same time. And thank goodness that we have a location like this, that someone can pick up the phone, they can call 211 and say, hey, I'm really in need of housing support. Where can I go for help? The call specialist on the other line can say, the Housing Navigation Center, there you go, they're there for you. They can help you and connect you to whatever you need. So you see there, we had 542 households that the Navigation Center helped specifically. And then we've had 596 individuals that had a safe place to sleep at the actual cold weather shelter. And I believe those numbers are from just last year. And so you can see there's great need, and we also have a great response, and it's something that I'm really proud of. I do think I think the last thing that's important to talk about in terms of what's being done in the community is just the fact that United Way doesn't do this alone. We have so many incredible partners that have made all of the work of Weld's Way Home, and particularly the Navigation Center and Cold Weather Shelter, a success. You're hearing from some of those partners today. We have many, many, many more partners. And again, that's really what it takes to help serve the folks that are the most vulnerable. I'll leave it at that.
Thank you, Melanie. And one thing I was remiss in adding is that this is being recorded. That's the beauty of having these virtual meetings, is that we record it and so it'll be available on the various online components of the United Way. So if you want to go back and review it or share it with friends and colleagues. So Meredith, let's get personal in terms of what does it look like as you're walking a person who's seeking services through that process. For example, if they're homeless, or if it's a veteran that's needing to find additional resources, or the mental health aspects. Walk us through that. What does that look like?
Certainly. Thank you, Mike. And thank you to everybody who is here listening. So as I walk through the journey of a community health worker and a care manager's integral integral role in working with individuals in our community, as well as the intricacies of community partnership, start to brainstorm in your mind what it takes for a community to restore itself from an emergency. So in May of 2019, a team of community partners came together at a monthly interagency meeting. The goal of the interagency meeting is to provide a multi-dimensional platform for case reviews and out-of-the-box problem solving for individuals in our community. The Department of Human Services brought a case to review. So I'm going to share a little bit of background on a particular story, and we'll just walk through what this journey is. So this is a young woman who is experiencing homelessness, has severe mental illness, a traumatic brain injury, and significant trauma. For the last 12 months, she has been cycling in and out of the judicial system. Child Protective Services is involved due to her inability to care for herself or her child. The member is judicially involved because she is unable to understand the provisions of a restraining order as a result of her untreated mental illness. At the time of the review, the member had been sentenced to work release due to continual restraining order violations, but was not taking any of her psychiatric medications, and the Department of Human Services' goal for the case review was to create a community treatment plan to ensure the member was connected to mental health services, as well as care coordination to ensure all involved partners were communicating with one another to avoid duplication of services, as well as enhance advocacy on the member's behalf. So the community treatment plan in action looked like assessing the member for additional needs and identifying any barriers. So the first barrier that we discovered was member had an insurance issue. At one point, she was on Social Security income and was enrolled in Medicare. It is unknown at what point this benefit lapsed, but at the same time, member also had Medicaid. The Medicare and Medicaid system do not communicate, and so when member was prescribed any medication, she essentially did not have pharmacy coverage, because when Medicaid was billed, the system would come back saying member had a Medicare Part D benefit. But the pharmacy was unable to bill this Part D benefit because they needed the policy number, which to anybody's knowledge did not exist. And so that was the first barrier. The second barrier that this individual was experiencing was she was being sentenced to work release for her continual restraining order violations. And when you're in work release, you're still considered incarcerated. And as a result, you do not qualify for full Medicaid benefits. The work release facilities mostly are managed through third-party contracts unless they do not provide any medical coverage or services for inmates in the facility. Eventually, the member was regressed back to the county jail due to her bizarre behaviors and making others uncomfortable. She spent several months in jail as a result. However, the multidisciplinary planning team mentioned prior, the interagency community partners never ceased working with the member while she was in jail. Every month, member's status was updated at the meeting. The assigned care manager continued to visit the member in the jail to build rapport and case plan with member toward her goals. Once member was approaching her discharge date from the jail, the interagency group came up with a step-down plan for member, and this involved North Range Behavioral Health, inmate services with the Weld County Sheriff's Office, North Colorado Health Alliance, and our CAPS system, the Coordinated Assessment and Housing Placement, Sunrise Community Health, as well as the Department of Human Services. So once she was set for release, the plan was that she would step down to an acute treatment unit, which is essentially an inpatient mental health facility, to ensure that she was able to continue her medication. The North Colorado Health Alliance would work towards with member on various social determinants, such as helping her get document ready for housing, ensuring she was connected to a primary care physician, and employment, as that was one of her identified goals. So member spent time in jail from October of 2019. That's the time she was regressed from work release to June of 2020. During that time, she underwent a competency evaluation and had several months of medication consistency. And upon release, she stepped down from jail to work release for 3 months and was successful. She is well engaged and very aware of her mental illness, and the interagency team reconvened to evaluate again a community treatment plan, to update the community treatment plan. The member had an established goal of employment, and we then integrated the level of the community health worker to assist in building a resume, job searching, and housing planning. So fast forward to today, currently this member is connected to a primary care physician with Sunrise Community Health. They are prescribing her psychiatric medications, as well as ensuring that all of her other medical needs are met and being addressed. She has obtained employment at a call center. She currently is residing at Kinnick House with North Range, and she's continuing to work towards independent housing with the assistance of the community health worker. Her insurance continues to be an issue, and despite multiple calls to both Medicare and Medicaid, there continues to be a database barrier. So to get around this and ensure member continues to take her medication and has access to her medication, various community partners have came together to ensure that there is coverage to that cost. When you think about it, paying for a prescription for an individual that is assisting them or helpful for them remaining stable is significantly cheaper than her cycling through the judicial system time and time again. And so the care manager has really been trying to navigate through this issue to overcome that. She's engaged with therapy at North Range, and she is working on financial budgeting with a community health worker to work towards savings for a deposit and first month's rent, savings for emergency needs, and then managing everyday spending to ensure that her paychecks are stretched out from pay period to pay period. One thing that the member is working on her own is trying to find financial assistance to help pay for a wig. So due to her brain injury, that is a result from a motorcycle accident, she has a large bald patch on her head, and she's very, very self-conscious about it. But nonetheless, she's, moving forward, well engaged, and it's really taken an entire community to support her and rally her towards reaching her goals. So now back to the beginning of what I asked you all to brainstorm and all that it takes to restore a community after an emergency. This happens every single day in the individual lives of the folks we serve in this community. It takes a community and a multi-dimensional community to assist individuals into the services and resources needed to address their needs and barriers. This is just one story, and we have over 300,000 individuals in Weld County. One last statistic I will leave you with is that it has been estimated that only 100 individuals account for every 1,000 calls and or usage of high cost systems, such as emergency rooms, 911 response, the judicial system, and the homelessness response system. Thank you.
Thank you, Meredith. As you can see, it's that case work intensive case and care management that is effective in this, and it's not easy and it's very intense. But thank you, Meredith, for your great work. Jodi Hartmann, you represent High Plains Development Corp, which is working on some affordable housing permanent solutions. So can you update us on that?
Yes, and again, thank you for inviting me to be part of this forum. I have so much appreciated the partnership with United Way and all that they are doing to help not only the homeless situation, but again, just developing permanent solutions. I always like to start with a little bit of history about who High Plains is, because we tend to be a little bit of an obscure and hidden organization, and it is actually a one-person operation. I'm the only employee. So this forum and the partnership with these community partners really helps to get this word out. But there is some work being done in the community on affordable housing. High Plains was established actually in 1994 as a nonprofit entity, partnering with the Greeley Wild Housing Authority. The goal was to develop low-income housing tax credit projects. So we did that in the late 90s. We established 3 projects in Greeley, 2 in Greeley and 1 in Dacono. We actually operate 64 units of affordable housing. About 34 of those units are senior housing and the other 30 are family housing. So in 2018, United Way, the United Way's Weld Way Home strategy identified that, you know, it's kind of a no-brainer that affordable housing is the solution to homelessness. So we knew that we had High Plains as an entity that could be resurrected and utilized to do this affordable housing development. And so that's what we did. And again, thanks to United Way for resurrecting and rebooting High Plains. We established a new board of directors and I was hired in August of 2019. So our mission is to be the leading partner in the development of housing opportunities for the low to moderate income households in Greeley and Weld County. That encompasses actually a pretty broad sector of our community, but our goal as an organization is to focus on those more vulnerable populations. So those households and families who are living at 30% of the area median income or below. And so you will know what that figure looks like. For a family of 4, it's $26,200 a year. These families are living or managing to manage their household in that level of income. The chronically homeless, of course, is one of our most vulnerable populations, but then seniors and veterans and those folks living with a disability. So these are the populations that High Plains is focused on in our housing development. There's the affordable housing continuum is very broad. I mean, it can be anything from actual emergency shelter for those who are experiencing homelessness all the way to home ownership. So there are developers out there working on all levels of housing. There are 2 or 3 projects in the community that are focusing more on that middle income or middle spectrum of the affordable spectrum. So the types of housing solutions that we will be working on and are working on right now are, first of all, just your mixed income multifamily housing. There is so much need in our community for that population living less than 30% of AMI. So that will out of necessity be a population we really need to focus on developing as much housing as we possibly can. The solution for that homeless population, that chronically homeless population, is a type of housing that is called permanent supportive housing. So this is where you not only have units that are designed for primarily that single adult population that has been experiencing chronic homelessness for quite a while. They will be required to have a dual diagnosis of either a behavioral health or a substance use issue going on. But these folks will be provided with housing and then support to go with that housing to make sure that they can remain in their housing and stay stable. So the case that Meredith described and all of the support that that person is receiving, that's exactly the kind of support that is built into that kind of housing. And those folks, those supportive, those care managers are actually officed on site. And there's the availability 24/7 for folks to receive support to stay stable. So what's been happening over the last 13 or 14 months is that we've identified 3 sites, 2 in Greeley and 1 in Evans, as potential sites for affordable housing development. We have also started a kind of a pipeline tracking of all of the affordable housing that's being built in the community or contemplated. Some of these projects are in just the concept stage or pre-development stage. In fact, none of them are under construction at the moment, but there are 7 projects planned in the community over the next several years. And if all of them are funded and brought to fruition, we will have an additional 586 new units of housing. So that's pretty exciting. And again, this, as Melanie mentioned earlier, this is not a race, it's a marathon. So affordable housing is a very complex financing process, and it usually involves applying for low-income housing tax credits. That is a very complicated and long process. And so that's why you don't see these affordable housing projects pop up as often as you will see a market rate apartment complex. But pretty exciting to know that we have a lot of developers looking at the community, and we have several projects really under pre-development. And long-term, I think we're going to see some real success with affordable housing development.
Thank you, Jodi. One of the questions that I would have, and for any of the panelists, is what's on the horizon for the next year, and more importantly, what's on the horizon for the next 5 years if we're thinking visionary. And if nobody volunteers, I'll pick somebody.
Well, I'll jump right back in then and just mention. So really, again, what we really all hope to see is this permanent solution to all of the work that's being done to work with our homeless population. So I'm looking here at our pipeline, and we have a couple of projects that should be actually under construction within the next 2 years. And these are projects that are in the pre-development stage, and we'll need to apply for those low-income housing tax credits, like I mentioned, but just those projects alone could bring in maybe another 250 new units for that lower income population. The permanent supportive housing that we're talking about, this is the more complex housing where you have both housing and supportive services on site. I would anticipate we are probably about 2 years away from one of those projects. We've been looking at some different models of delivery. One of the models that's out there is a campus approach where we would potentially be able to place a new housing navigation center on site, and then also have that permanent supportive housing right there in the same campus, and then fill in the remainder of the project with those mixed income multifamily units. So you have, you're serving 3 different distinct needs on one campus, and it's a pretty exciting model. There's one project like this down in Denver. It's called the Aurora Village. So if we're able to acquire the land to make this happen, that's always a big part of this equation, and then establish all of this complex financing and funding, we will have one of those projects. My guess is within the next 2 or 3 years.
Thank you, Jodi. Melanie?
Yep. Yeah, I'll just add on to what Jodi said, and just we know what works. We're doing what works, and that is That's the navigation center and cold weather shelter. That is that multidisciplinary team that Meredith is working with all day, every day. That's the permanent housing that Jodi is talking about, right? We know what works. To have all of that in a campus, in one location is just so exciting. And again, Jodi said there's models here locally across the entire United States. There's a group over in New Jersey that ended homelessness, that ended, I think it was chronic homelessness. And they have this model. They have a navigation center, and they have permanent supportive housing, and they have these multidisciplinary teams, and now they're working on prevention. So we know this works. It's time to do it here, and to accomplish all of that in the next 2 to 5 years would be an incredible feat, and one that is so needed for this community.
So in case you missed that, what Jodi was talking about was Arroyo, Arroyo Village. If you want to look it up, it is a really cool concept, and something I think that's on the horizon of everybody. I'm going to ask either Angel or Meredith to talk a little bit about what you are most proud of in the work that you've done so far on this, and what are some of the frustrations?
Well, I feel very proud of so much of the work that's being done, but seriously, the sense of community and just the partnerships that have been built, I think, is something to speak for. I came into this work a decade ago, and it was so interesting to know that we had all of these great resources, yet everybody was working in their own silo, and folks were accessing each silo to meet their needs, which isn't effective or efficient. So if anything, what I'm proud about is the sense of community that we've built and the hard work that we've done, from the United Way's Weld's Way Home Strategic Planning, convening that multidisciplinary team to help create that strategic plan, to convening the partners that spearheaded the Community Action Collaborative. We've all just really came together and understood that we need to do the work together in order to help folks get the services and resources they need, but also to work together in a more efficient manner.
Thank you, Meredith. Angel?
So one of the things that I'm most excited about is, to the layperson maybe watching this whole process, it would be easy to say, well, I hear you guys saying a lot about things are happening, but I don't really see that much on a layman's kind of level. Let me share with you something that I think is really exciting. I was just texting Melanie actually to make sure I had the right numbers. Veteran homelessness is a very hot topic, and it should be. These are the folks who served our country and now are living out of doors. In Weld County, we are 8 veterans away from practically ending from ending veteran homelessness. And what I mean by that is there are 8 veterans in Weld County right now that are homeless, that have not been offered a voucher or any kind of housing voucher. So aside from that 8, we are so close to ending veteran homelessness in Weld County. Think about that. The work that has been happening has led us to this point where we have almost eradicated veteran homeless. That is something I'm very excited about, proud of, and looking forward to knocking out those last 8, because that is going to be a huge day. Yeah, so that's, and then once that's done, we're going to move the needle and start eradicating chronic homelessness. And the reason that's so important is, again, that drain on community resources. And also think about the idea that there is not a homeless person in Weld County. Like, it's not that we can get there, we will get there. We are going to get there. The things that Jodi is talking about with this campus approach is part of the way we get there. Think about the idea of someone who is living out of doors, moving into a shelter that is surrounded by all of the resources they need to then move on that same campus into permanent supportive housing. So they walk in one door and are now living in their own place. And maybe they could even work themselves up to workforce housing, where they are now, working and making their own way. It's an exciting approach, an exciting project that not only could happen, is going to happen in Weld County. We are going to do it.
Thank you, Angel. I'm going to hand it off to Janine Trustwell, our CEO and president of United Way of Weld County, and let her wrap things up. Janine?
I do this every time. I forget to mute. Thank you so much, Mike, and thank you to our presenters and to all of you that are listening in and watching our first virtual community forum. United Way of Weld County is so very proud to be a part of this work, to help bring the community together to address one of our most significant problems in Weld County, and that is homelessness and household instability. As you heard, the solutions accomplished take more than one organization. There are literally another 25 to 40 organizations that are not on this call that are a part of this solution. And so to end homelessness and to achieve household stability for our community, we have got to have nonprofit organizations, government agencies and municipalities, faith-based organizations, community leaders, businesses, individual volunteers that step forward to work together on this issue. And so, like, what does that mean, by working together? Well, you saw some of that with the few organizations that were represented here during this forum. What is common with all those organizations is they're aligned, they're communicating consistently, and they're working towards the same goal. So we're all talking to each other, and we're not just talking about what we do, we're talking about specific clients. And we're talking about, wrapping services around them so that those people can achieve success. We indeed can end homelessness. This project on ending veteran homelessness started in 2016. And it actually was a regional project between Weld and Larimer County. And over 40 different organizations are to this day meeting weekly to talk about how we wrap these services around. It's called the CAP system, or Coordinated Assessment and Placement. And they're still working together. We only have 8, but in Weld and Larimer, we literally have housed almost 400 in that amount of time. And so it is what makes us know. Dave was a 20-year homeless veteran who suffered all kinds of trauma during that 20 years. And Dave, by the community health workers and him coming to the Housing Navigation Center and him being a part of this case management of all the organizations working together, he is now in a studio apartment after 20 years being homeless and doing better every day. And it's not like we house and then, okay, we'll see you later. No, these agencies keep in contact to make sure that folks like Dave are, remain housed. And so that's why it's so, important. So we can do this. As Angel couldn't have said it any better. We can do this. But how do we continue on this path and this collaborative work? And again, United Way can't do this alone. We're not doing it alone. You saw some of the organizations that are helping, and we need all entities to step forward. We need resources. And what are those resources? Those are to get people to give, to donate, to the many, many organizations that are involved so that they can continue to deliver services. We need volunteers to be engaged, whether they're on a committee or they're cooking a meal or whatever it may be. And we need advocates, people who will lend their voice for our most vulnerable and learn more themselves about what these issues are and what are the solutions, and how are some communities doing it, and what can we do here right in our own community of Weld County to make a difference, because we can be one of those communities that has ended homelessness. If you're interested in helping, please contact us. If you want to learn more, please contact us at United Way of Weld County, and we'll get you connected with the right folks. And again, I just want to thank each and every one of you for listening in, and for your interest. And if you have any questions, please do not hesitate after today to give any one of us a call. So thank you so much.